Okay, let's talk a little bit now about another serious issue that has to do with patient safety and the rise of people who aren't plastic surgeons actually trying to do plastic surgery. So are you seeing that problem here in Austin?
We definitely see it here in Austin. We see the broad spectrum of everything from, non-core providers doing injectables to surgeries being done by really kind of any gamut of providers. And it's really hard because it's confusing for patients to know who's actually doing their surgery, who they're seeing, and then what type of training people have had. And so really hard, especially, and maybe a little disappointing, especially in a city like Austin, where there's at least 30 or 40 phenomenal plastic surgeons. So people have good choices in a city like this, and for them to kind of get led astray is sometimes disheartening.
Yeah, so what would you tell people out there to look for if they were trying to find someone to do their quote-unquote cosmetic surgery?
Yeah, I think one of the things is, and we're to blame a little bit in terms of the Society of Plastic Surgery. We used to ask people to ask their physician if they're board certified. That's not enough, because people can be board certified in all sorts of things. There's also, not to get too complicated, a certain group of American AMA, recognized board certifications, but make sure what the training's in. Is someone who's doing your breast augmentation, tummy tuck, are they truly a plastic surgeon? And when you're a board certified plastic surgeon, it means that you've done a set number of surgeries in that. It means that you have hospital privileges here to admit somebody. There's a whole gamut of things that are there for your protection, which isn't necessarily true if you're not in that category.
So you would say it's important for someone to be board certified by the American Board of Plastic Surgery. So you kind of touched on this a little bit about hospital privileges. Is that a question that you could ask a doctor?
Absolutely. I mean, and I tell patients, write down your questions when you come into the office. You're going to be nervous when you meet us, especially when you meet a rock star like Dr. Rios, but write down your questions. There's a lot going on that day. We don't mind it. We'd rather you have your list of questions and we go through them all than you feeling like you're not all the way there in terms of informed and everything. Ask, do you have hospital privileges? Where are they? Have you ever had any serious problems? Ask your physician that. You can ask them where they did their training. You can ask them what their specific specialty is. All those are common questions. Even ask them, do you perform this procedure regularly? And even follow that up and say, hey, I'd love to see some before and after pictures. If somebody doesn't have any before and after pictures of a specific procedure, it's probably unlikely that they do 2,000 of them in a year. It could happen, but seems unlikely.
Yeah. What about possibly operating in someone's office?
I think that's a difficult one, because a lot of people have their own surgery center attached to their office, but there's definitely a difference between having an accredited surgery center versus just doing in-office procedures. And this, again, I think goes to the question of asking, who manages the surgery center, what accreditation do they have, do you have an anesthesia group, or who provides the anesthesia? So I think those are very, very important questions.
I think, what's really hard is that right now, this kind of discovery is kind of dependent, or is in the hands of the patient, right? Because there's no laws, so anybody could theoretically do plastic surgery. We could probably do neurosurgery if we wanted to, until something happened and they took our license away, but we could maybe get away with it for a few years because there's no law that says we can't do neurosurgery, right?
Correct.
So there's people that are trying to do plastic surgery that have no training whatsoever in it and get away with it for a while, and sometimes their licenses don't get taken away, sometimes they do. And so right now, unfortunately, it's kind of left up to the hands of the consumer, the patients, to figure out, and it's just so complicated, it seems like.
Very, very complicated for patients to go, because a lot of these terms, cosmetic surgery, plastic surgery, etc., are confusing.
So again, so if someone was writing down a list right now, this second, what would you tell them to ask for?
One, make sure that someone's board certified in plastic surgery. Ask them what they're actually board certified in. I would ask them if they have hospital privileges and if they have hospital privileges, if anything happened with the procedure they're having done, I would ask them where the surgery is actually going to take place, and if that's an accredited center or what the situation is there. And I do have people who ask me, hey, if let's say something was to happen, what is your protocol in terms of, you know, how you take care of me afterwards? And all of us have a system at our surgery center of how we deal with that. You know, and it's the old Boy Scout adage, if you prepare for it, it doesn't happen, but at least there's a plan if there was ever something.
Yeah, I know in my accreditation, I have to have a bomb threat plan. If somebody threatens to blow us up, we have to think of everything, because that one time that you might need a certain medicine or have to go with a certain protocol, you already have thought of it and you're very well prepared, right?
And you don't only have the protocol, you guys practice it. You have yearly sessions where you go through all of these. You block out time again to make sure everybody knows and everybody's done it.
Yeah. So I guess the lesson here is plastic surgery, even though it's on TV, even though it's on social media all the time and it seems like it's fun, ha ha ha, it's actually pretty serious surgery, and we don't want our patients to have problems, and so
no question,
you know, and so unfortunately at this current time in Texas, there's not a whole lot regulating who can do it and who can't. So I think patients just need to be aware that you need to look for a board certified plastic surgeon, you know, and make sure they have privileges in the hospital to do the same privileges, the same procedures, because hospitals don't give out privileges to unqualified people. And if people operate in their office, make sure that the office is accredited or certified, so they have all the safety procedures and everything in place to take care of them should something happen.
You're not offending your plastic surgeon if you ask them that if they're board certified in plastic surgery. I mean, I welcome that question. So if somebody's evasive or offended by that question, you know, that may be a sign that you need to ask more questions, because that doesn't bother me. I don't think it bothers you.
As a matter of fact, it's like, that's great. I have a patient who's doing their research, and for those of us who are trained well, because it's not easy to be a plastic surgeon, it's a welcome question, because now I can share my experience and everything that we've done. Because tell people how hard, you know, how many plastic surgeons are trained every year. I don't think the public actually even knows that.
No, it's amazing. I mean, in my class, we only had 2 plastic surgeons in every residency class.
Right. So in total, I think there's probably 200 or a little over 200 plastic surgeons trained every year. Now we can train
in the entire United States.
In the whole United States. And in medical school, you have to almost now be number 1 or number 2 in your class to go into plastic surgery. So so you've got the best of the best being plastic surgeons. So that's why if you go with a board certified plastic surgeon, you know, at least that's a good starting point. You're getting kind of some of the best well-trained and minds in medicine working on you. And that's why if you don't get a plastic surgeon, you're going to be settling for something a little bit less.
Because, you know, when you and I did training, we have to meet a certain minimum in each category. So there's at least a minimum threshold to finish plastic surgery residency that you have to meet. We had to do so many breast augments, we had to do so many tummy tucks, we had to do so many free flaps, and so there was a threshold that we had to meet to get out into practice. And I think that's what, you know, is important, is people know that there's a minimum standard that we had to go through for 5, 6, 7 years, depending on your program, to even be able to treat patients.
And to pass the board certification exam is very difficult, and then we have to retake our boards every 10 years and do other things to keep up to date every year.
For some of us that are a little on the young side, we haven't gotten to that point yet.
I'm already going to do my 3rd one. I'm up for my 3rd one next month. So it's, you know, you look, it's not something you look forward to, but it's something you have to do. And so you do it. And, you know, that's just part of it. And so, but it does keep us up to date so that we're practicing the most modern medicine out there. So anyway, this is probably going to be the end of our first podcast here. I thank you very much for coming and, you know, joining us. It's great to be in your city. We're going to go...
Appreciate you inviting me.
Yeah,
if you don't, follow Plastics Rios. It's got a lot of great content, so you'll love it.
So we'll see you next time. Thanks for joining us. I hope you got something out of this, and we'll see you next time.
Bye.